Welcome to this Mental Health and Resilience Practitioners Forum. I wanted to start just by giving you a reminder that as Starlight, our work is always led by insight. So first of all, sorry, this is who we are, but we did that already. So how do we make sure that we lead with the evidence? So the insights team here, I tackled that by starting with a literature review. The aim of that literature review was to look at everything that we could find on the long-term impact on mental health and well-being of hospitalisation and medical treatment in childhood. And then further to that, to review the evidence on the impact of play as a mitigating factor to that long-term negative impact of hospitalisation and medical treatment. So far, 105 articles have been looked at with a scope of 2012 to 2022. And they cover things like children's hospitalisation, long-term impact on mental health, play and children's play in healthcare, therapeutic play, resilience, child hospitalisation, building resilience after hospitalisation, childhood healthcare, child life specialism, which is the American version of a play specialist, and also health play specialist practice, paediatric medical trauma stress, and transitioning from hospital to home. A huge topic, transitioning in all respects. The emerging findings so far within this research can be put roughly into three categories. Illness in childhood and the experience of undergoing intense treatment can cause long-term post-traumatic stress. Patients can experience trauma from both the incident itself and from the recovery process. So how we treat children and help them to recover can be just as problematic as the illness itself. Children do remember feelings of treatment, and in cases where they've not been informed, would have definitely benefited from knowing more about their treatment. Hospitalisation in childhood can have significant long-term impacts on children's mental health and well-being, including anxiety, distress, feelings of vulnerability, being isolated, and a loss of security. So we found in that literature that children's lack of interaction with others is a key point in compounding long-lasting negative effects. Significantly from that literature, it's clear that the whole family can experience the long-term impacts of the child's hospitalisation. We saw that families of lower socioeconomic backgrounds experienced more challenges in this transition than other socioeconomic family groups. Families with seriously ill children and hospitalised children invest significantly more time and resources on the care of those children.
I'm so sorry, I can't see the screen, and someone else has now put in the chat that they can't see either.
Oh,
I'm so sorry to interrupt. I keep reloading it because it keeps saying reload, and then it just whirls around and then it doesn't show me the presentation. But Claire Davey has just seen the screenshot, so other people must be seeing it, but
yeah,
me and another lady can't see it.
Thank you so much. No need to be sorry. Thank you so much for speaking up. So
more people are now putting they can't see it either.
Can I ask, can you see it now?
No.
Bear with me for 1 second. I'm going to stop presenting. Okay, so now you should. Now you should.
I can see everybody there. Yeah,
that's brilliant. Thank you.
I'm so sorry about that. I just didn't want you to carry on, and none of us can see it.
I really appreciate you telling me. So, what can you see now?
Just a loading thingy, but some people are saying they can see it, and some people are saying they can't. So maybe it's just I don't know.
Okay, I've had some people say they can see it now, so that's really amazing. Thank you. Great.
Would you able to email it out so we can see it, us who can't see it still?
I absolutely can do that. Yeah.
Thank you. Sorry.
No, absolutely. Really grateful for you telling me that you couldn't see it, because it seems like now we should be able to see it. Is that the case? Okay, great.
Personally, I can't, but other people can. So
who am I speaking to?
I'm Claire Oakley, but there was some other people.
Hi, Claire.
Hi.
Thank you.
There's some other people saying they can't. There's still some others in the chat saying they can't, but
Georgia's saying she can't.
Yeah, I just didn't know if you could see the chat. So anyway.
No, that's fantastic. Thank you. No, I couldn't see it. So I'm going to press on. And Louise, did you want to add something? No. Okay, somebody's saying if you try leaving and rejoining the call. I've been able to see it okay since the start. Oh, do you think this is something to do with, I don't know, maybe a meteor shower, possibly?
I'll leave and rejoin.
Okay, well, we'll make sure to let you in as soon as possible. I'm just going to recap on these slides. So, as we've spoken about, we did a literature review. I've talked through how many papers we looked at and the top line findings. I was just talking about the impact on families there. It is really backs up our position of thinking about the child as part of an ecosystem, that the literature is telling us that families, including siblings and parents, also have experienced negative impacts of a child's long-term hospitalization. Okay, so that is really, you know, what we've looked at so far, that is coming out loud and clear. And I think that is really important for us to remember when we are treating that child. The child is not merely their illness. They are this very sort of like embedded and complex being that's part of a family unit and a community group, and has an inner life of their own. We also saw that through these emerging findings, the mitigating factors for these long-term impacts play and is very strongly a mitigating therapeutic factor against that paediatric trauma, anxiety and distress for children's healthcare journeys. As highlighted in Article 12 of the United Convention on the Rights of the Child, it is important for children to understand what is happening in their healthcare decisions. This will have a positive impact on their experience and outcomes for life. So we're finding in the literature that it's backing up the principles of health play specialists, our sense that it's important to be prepared, to know what's coming and to have some choices where possible. That crucial role the health play specialists and other sensitive adults within paediatrics have in giving children that positive experience is backed up by the literature we're reading, and it is encouraging the surmising that the healthcare setting should take the whole family approach in supporting the mental health and well-being of children in healthcare settings. So this, having said this, we want to now hear from the field. So what does this look like in practice? And I am pleased to be able to hand over to my colleague, Rebecca.
Hi everyone, so I've been asked to talk about what I do in practice with regards to mental health and resilience, and then also provide you with a case study of a patient that I've worked with. So next slide please, Laura. So what can you do when working with your patients with regards to promoting resilience and mental health? One of the most important things that we can do is to provide a safe environment for the young person to be able to discuss any matters that they wish, whether that's they want to speak to you about school or friendship issues, or if they're struggling with their mental health and well-being and would like to discuss that further. It's really important that you let them know that you are a safe and non-judgmental person to talk to. And you can tell them this, you can let them know that you're safe, but also one way that we like to do it is with badges on our lanyard. So for example, I have a badge which says what my pronouns are and asks the teenagers that I work with to share their pronouns. also have a badge which makes them aware that I am happy to chat about mental health with them if they wish. It's also important to have information available for them in case they feel as though they don't want to chat about it, but they do want to know more things. So for example, up in the common room, we've got a display of NHS approved apps which supports their mental health and wellbeing. And we also have a lot of leaflets and posters with regards to Best for You, which is part of Chelsea that they're developing around the mental health of young people, and that also has a website with lots of information on. Also really important to look at the resources that you have so that the young people can use when they are anxious, such as you have stress balls, fidget toys, that kind of thing. So that will really help them gain support and get some of their anxiety out. Something which we saw a lot of in COVID was that young people's mental health and resilience definitely dipped when they didn't have the interaction with their peers that they usually have on the ward. So where possible, in line with COVID guidelines, promoting those games and activities, whether it's playing a game of cards or a board game together or just sitting and chatting, is really important for young people and their mental health and resilience, especially those that are in hospital for a longer time than just a day or so when they're missing out on interacting with their peers. Having creative activities which promote mindfulness is really useful. So diamond painting is something that all the young people are loving at the moment. Creating ojo de Dios, which if you look on the picture, it's the ones that look a bit like a kite. It's a weaving exercise and it's really mindful, and a lot of the young people find that really therapeutic to do. And also we've found making what we've called breathing keyrings really useful. So that's using modelling clay and beads, and you can talk to them about box breath and other different types of breath, and you put the beads in, so as they touch the beads they do the breaths, and it's also something really tactile for them to use. You can also use creative activities to promote and support the release of emotions. So a good one for this is the use of syringe painting and splatter painting. The young people might start off in a bad mood, but once they see the paint flying everywhere, usually missing the surface that it's meant to be going on, it definitely starts to improve their mood and help release their emotions. I also do quite a lot of sensory activities which help to support anxiety and difficult feelings. So I'm making lots of slime, but one that we actually find the young people prefer more than slime is making Play-Doh fresh, because you have to use like warm water for it, and they really like how that feels, and it just makes them feel really relaxed. And they're also making stress balls, which we use hospital gloves for, and you can try out all the different textures in it. So water beads, water, flour, shading foam doesn't work, just so you're aware, and just seeing which scents that they like the use of. And also if you put a little bit of aromatherapy oils in it as well, that really helps the young person. So when they're doing a deep breathing, they get to smell the aromatherapy oils as well. And then, so this is a case study that I've been asked to present, and the name's been changed, but the young person is Claire. And when they came to us, they were a 15-year-old patient. They were a CAMS patient, and they had their 16th birthday whilst in hospital. They had 3 admissions with us over quite a short period of time, from August till November 2021. And the reasons that they were brought in were due to self-harm, suicidal ideation, they were restricting food, they had a difficult relationship with their mum, and they also had confusion around their sexuality. They were brought in by ambulance on all 3 times as they had taken an overdose, and had also been found walking along the motorway wanting to throw themselves into traffic. So the youth work that I did with Claire during her admission to support her mental health and resilience was, first of all, establishing a relationship with Claire. And the relationship that I established with her during her first admission really helped to support the work in the following admissions, especially in the last admission when she was with us for 5 weeks. Being non-judgmental and calm, having a calm attitude regardless of how she presented, whether she was presenting as low in mood or quite angry, just always making sure that you're non-judgmental with regards to whatever she wanted to talk about as well, whether that was her sexual identity, her mum's alcohol use. Just really making sure you're there, you're calm, and you're not judgmental. Because if the young person is really struggling with their emotions and you're not sure how to act, they're going to get more and more riled up. So if you're calm, it will bring how they're feeling down to a level where they can then interact with you. I did daily one-to-one sessions with Claire. We did activities as a distraction, so we played a lot of cards. We went outside on walks once it was deemed safe that she could do this without being at risk of throwing herself into traffic. And most of all, she really benefited from having a safe space and a safe adult to speak with. Whilst working with Claire, we found out that her preferred way of communicating her difficult feelings was to write things down. She found it really difficult to verbalise how she was feeling. She was very worried that she would be judged and that she'd see judgment in people's eyes, or that she'd feel ashamed when she was talking about the difficult things. So she started to write things down. And so when I go see her, she'd show me her mobile or her notebook and just ask me to read things. And then we discussed how she was feeling, which worked really well with me. But for some people, she didn't feel as though she had the relationship with yet that she could ask them to read what she'd written. So we came up with traffic light cards. So as you can see from the picture, we had 4 different colours. So we had the green, orange and red as the traffic light. And then we also had blue, which was in relation to her anxiety. Now on the outside of the traffic light, of the card, it said how she was feeling. So for example, green was I'm feeling good. However, it asked you to open it up, and on the inside she'd written, I might just be saying I'm feeling good. Please can you check with me that that's how I feel. On the orange, it was that she was feeling blah and that she could easily turn to red, and red was the place that we really didn't want her to feel. We wanted to try and support her not to get to red, because that's when she had a lot of thoughts around suicide and wanting to self-harm, and we were trying to build her resilience and her coping tools so she didn't get to that level. When you opened them up, it said inside what would be useful for Claire to do at this time if she was feeling red or orange, and also what she would like us as professionals to do to support her. And that worked really well with the use of those cards. Staff members would come in and check it was the right colour and then read through it and then act as Claire would like. Also did a lot of work around improving Claire's self-esteem. She has a real passion for music, which was encouraged. When she first came in, she liked to sing but refused to sing in front of everyone. I actually went with her to the school one day and hid in one of the smaller classrooms. She knew I was there so that I could hear her sing, but she didn't actually have to see me. By the end of her stay, we had her up in the radio, which we used as a recording studio, and she recorded her own songs that she'd written and also some covers. We developed a timetable and routine because Claire would have quite easily stayed in bed all the time if we'd let her. So on the timetable we had when the doctors would hopefully come in to see her, sessions with myself when she'd go to the school room, space for her just to have to chill out and relax and do what she wanted, and also times when she'd see the art therapist. Also did quite a lot of work with Claire around challenging her perception of CAMHS. She'd had a bad experience and so thought all experiences that she'd have with CAMHS would be difficult. And so just trying to let her know that there are members of CAMHS and members of all staff that she would come into contact with that she could trust and share her feelings with, and she wouldn't be judged, and she would be able to find other professionals and not just the ones in the hospital. And also did a lot of work in advocating for Claire, supporting her in meetings with professionals such as CAMHS and psychiatry. And the next slide, please, Laura, explains a bit more about how we looked at advocating for her. So Claire was due to be discharged on the 28th of September. So I was really concerned about this discharge because she was saying to me that she would commit suicide when she was discharged. So I went and spoke to safeguarding leads, matrons, ward managers, CAMHS, to share my concerns, and it was told that she would still be discharged. And so I contacted Claire's local CAMHS team to make them aware of what she was saying to me and to ensure that they could see her the next day. Made Claire aware of this, that she would be discharged, and she was, but she was brought back to A&E within 10 hours after she'd been found walking alongside the motorway, and that led to the 5-week hospital admission where we were able to do some intense work with Claire. And then the next bit is just a little bit of feedback. Sorry, can we go back to the previous? Sorry, thank you. A bit of feedback that Claire gave while she was here. And then if you want to read that, and I'll just give you a little bit of an update as where Claire is now. So Claire now has built up a really good relationship with her DBT therapist, who she sees every week, and she finds it really beneficial. She's at college studying performing arts and is attending lots of open mic nights in regards to her singing. She is a really active member of the Hospital Youth Forum, which is brilliant, as we get to hear about her views of while she was in hospital. And she actually came to the youth forum that I did this past Saturday, and we were talking as a group about drawing, and I mentioned that Claire was really good at drawing. And she was like, yeah, I am. And it was so nice to hear her like speak about herself in that way and to accept a compliment. And I said this to her afterwards, and she said that she'd been working really hard this past year in developing her confidence. And you can really tell. It's just so nice to see how she's flourished in this past year. So that is Claire. And she did write a song whilst she was in hospital. Unfortunately, we can't get the music to work, but these are her lyrics if you want to just have a quick look through, which really explains how she was feeling whilst she was in the middle of her crisis.
Just while people are reading that, just to say thank you so much, Rebecca, for sharing that with us.
Thank you.
It's a really fantastic example of how that person-centered approach, giving the safeness of space and opportunities to use creativity, to be consistent and to bring that young person into your calm consistently, has had such an amazing impact.
Thank
So
you.
thank you so much.
Thank you. And some people have just put in the comments that when they press play, the song is actually working for them, and that she has a beautiful voice, and she really does have a beautiful voice. She's still sharing her music with me in the youth forum, and it's just, her lyrics are so powerful as well. Yeah.
Thank you so much. Just to say, we will, because some people have had difficulties seeing the presentation, we will send this out. If you would like a copy, please do add your email to this chat. So following on from that, the question that we have is, how might you in your practice take care of your own well-being? And so I'm going to now pass over to Natalie.
Thank you very much, Laura. Hi, everybody. So I will be talking with you about self-care when supporting mental health and resilience in the patients that we see. Obviously, hearing from Rebecca, we as professionals do some amazing work with the children and young people that we see. And we give a lot of our time and our energy and our efforts to them, but it's also very important, and a lot of my role that I'm currently doing at the moment as Playing Youth Service Team Lead, to make sure that we're looking after our own mental health and our own resilience and well-being. And I've just put a few slides together to talk to you about the ways that we do that here at Chelsea and the benefits that we get from them, to hopefully share some ideas with you. So one of the first routes that we go down with looking after our own mental health and resilience is using support from other members of the MDT. We are very lucky here that we work very closely with CAMS and art therapy and psychology, and lots of other professionals within the trust. And I approached CAMS right at the beginning of COVID, which was probably not the best timing, to talk to them about providing some reflective practice sessions with the Play and Youth Service, which would give us the opportunity to share our skills and share with CAMS what we do, how we support the patients, and build up that understanding of our role and CAMS' understanding of that. But also to give us the chance to learn from them, to idea share with them about what a CAMS admission may look like, what terminology we should be using when we're working with our patients. Some feedback that I was getting quite regularly from the team was that some people weren't overly confident when supporting a patient's mental health. and they were asking for a lot of extra support around certain words to use, certain words to avoid, certain times of the day that may be best to support this patient, and how to really approach the work that we do. So we used CAMS reflective practice to learn about improving our practice. But also it gave a big opportunity for us to reflect on how it made us feel, what we were taking away from the input that we were having and the support that we were giving, what difficulties we were facing from that. And as you can all see from the previous slides, we're very lucky to have an incredible youth worker that works with us that has a lot of experience, and she was able to share with us a lot as well. So it gave us a safe, confidential space to talk with CAMS, but also to talk as a team and learn from each other about the ways that we were supporting our patients, not just our patients that were coming in under the CAMS team, but also the general support of mental health and well-being for all of our patients that we were seeing in such a difficult time for them. Next slide, please, Laura. Thank you. We also are very lucky to use clinical supervision within Chelsea, where we set up one-to-one supervisions for our team. We generally do it on a basis of if a member of staff feels the need to have clinical supervision, they will talk with me and we will speak with members of staff that it's appropriate to hold the supervision with. So that may be art therapy, music therapy, psychology, and it gives that member of staff that one-to-one space to talk openly with somebody who is able to support them, to help them to build their own resilience, gives them the opportunity to share their experiences backwards and forwards between the two people, to develop their coping techniques around supporting the patients that we see. Again, not just patients under CAMS, but all of the patients that we see who we are in our day-to-day work, we're building their resilience and we're supporting their mental health in everything that we do. And it's really, really important to have that time to share that, so we're not holding it in and we're not keeping it within ourselves. We're having that opportunity to talk about it, to reflect on it, to support your own mental health. Clinical supervision is, for us, a good tool in doing this. We've also been fortunate to have some one-to-one sessions with the CAMS staff that do the reflective practice sessions for us as well. So there's lots of different opportunities for this with lots of different other professionals to support us. As well as this, we will do our regular supervisions with our members of our team. So we have supervisions with our senior members of staff or management, where it gives us that opportunity to talk to people that understand, talk to people that know what we're doing day in, day out. They see for themselves what we're doing day in, day out. And it's having that opportunity to see what we can do from a team point of view, from a trust point of view, additional training that may be available, additional support that may be needed within the team, to offer that extra support to ourselves and help us to build our own resilience and look after ourselves in that. Next slide, please, Laura. Thank you. Running nicely alongside that is our team meetings. So we try where we can, around the pressures of the wards and the pressures of the service, to have team meetings every other week where we can. And we use this a lot to share information about patients, debrief about patient interaction that we've had. It's a good opportunity to talk in detail in a confidential space about the patients that we've been working with, talk about the experiences that we've had, and to learn how each other is working with certain patients to support them, support their mental health and their well-being, and to support their experiences of the hospital. We will also use our team meetings to skill share. As I said, Rebecca has been amazing with sharing her experience and her knowledge with us to help build our confidence with working with children and young people's mental health, which in turn has helped us. It's meant that we're a lot more confident and we're a lot more comfortable with the support that we're offering, and we have a lot more trust in ourselves with what we're doing and the support that we're giving. we have also tried to make a big chunk of our team meetings around building ourselves up as a team. So we use a praise jar, who we've named Georgia the Joy Jar. And the idea for that is that each week, if another member of the team has done something that particularly stands out, that has really helped you, or that has supported you, or that you've really, really appreciated, we write it on a piece of paper, put it in the praise jar, and then I'll read it out at each meeting so that it has that level of anonymity. So people feel comfortable to share their feedback, because I know sometimes people find it quite difficult to have that conversation, whether that's positive or negative. And it's just having that chance to thank each other for the support, thank each other for being there, and to help build each other's resilience. And then finally, we will try to do some fun team building games. So we played a game once of
Taco, cat, gut, cheese pizza,
which Rebecca plays a lot with the teenagers, and it taught us a new skill, it taught us a new game that we can bring to the teenagers, but it also just really relaxed everybody. It brought some fun to the meeting, and it made us communicate together, and it was a really fun way to end the meeting on a high and let everybody go back to the wards and go back to their everyday work feeling good, having that laughter at the end of the meeting. So I think it's just, as much as what we are here for is to support our patients, and we are here to build them up and to support them while they're here, we can't do that if we don't look after each other, and we don't look after ourselves. So I think it's very important to follow those slides. Thank you, Laura. That's the end of mine.
Thank you so much, Natalie. It's so rich, and the breadth of stuff that you've described. I really hope that there are people in this group who are storing up questions to ask you at the end. So thank you so much for sharing that. I'm going to now pass. Thank you. I'm going to now pass on to Cheryl to really sort of round up for us from a slightly different perspective. Cheryl, if I could hand over to you.
Thank you, and thank you for inviting me here today. So, as I said at the beginning, I'm Cheryl, and I trained as a psychiatrist and worked for 12 years as a psychiatrist. However, throughout that time, I struggled with my own mental health, and certainly the stress of the job didn't help with that. So I left clinical practice about 8 years ago, and now I teach mental health. And I've been working with Starlight, teaching some of the play therapists around mental health first aid. So thinking about what it's like for you guys working in a job that can be busy and stressful, and the impact that can have on your own mental health and resilience. So thinking about how are you going to look after yourselves today? Now, I've got a story about resilience. It was a word that for a long time I didn't like, because when I worked for the crisis team, as a team, we were made to support around 50 patients who were either suicidal or were having acute psychosis. But actually, in reality, we had about 150 patients, and our team was so overworked and so stressed that loads of people were going off sick. And our trust did this listening exercise where they came in to talk to us about what was the problems, what was going on, and we were telling them that we haven't got enough staff, we've got too many patients. And the trust's response from that was to give us resilience training, which really upset me at the time, because, you know, as a team, we were very resilient people. We were working in a really difficult job. And I know that you guys are also working in difficult jobs, and you guys are also pretty resilient, really. So I'm not here to talk to you about, you know, these things without an understanding of what you're going through. Your job, why does your job make you vulnerable to stress? Well, all of you are caring people. That's why you've gone into this job in the first place, because you care about people. And I know that you're seeing distressing things probably on a daily basis, working with children and young people with various diseases and illnesses. And you need to stay connected to them emotionally, and that can be really hard work when you're putting in that emotional work. And so all these things can add up to the stress that you're feeling when you're at work. And as you might be able to see on the screen, for those of you that can see the screen, I've put up these definitions of moral distress and moral injury. This was a concept that I came across just a few years ago, which was developed in relation to war veterans, but now is being increasingly recognised as something that hospital staff go through. And actually recent research has shown that about 50% of doctors identify with these feelings of moral injury. So moral distress, it says here, the definition, the psychological unease generated where professionals identify an ethically correct action to take, but are constrained in their ability to take that action. So what that looks like is you really want to do a good job. You know what a good job looks like and what you would have to do that good job, but you can't always fulfill those expectations, and you feel that you can't meet your patient's needs, whether that's due to a lack of time, lack of resources, lack of staff. And if you have this moral distress over a period of time, it can lead to moral injury. As it says there, moral injury can lead to impaired function or longer term psychological harm. It can produce profound guilt and shame, and it's been linked to severe mental health issues. And I think a lot of us would identify with those feelings of moral distress and moral injury. So if we're having these feelings, how do we deal with that? And how can we look after ourselves when we have these feelings? In my own story, thinking about self-care, I know when I worked in psychiatry, nobody really talked about self-care, and it wasn't something that I thought about a great deal. It was only after I left psychiatry, our family started fostering, and as a foster parent, you do a type of parenting called therapeutic parenting, which is a different way of parenting children with lots of trauma in their life. And every book that I picked up about therapeutic parenting always has a chapter on self-care, because they recognise that if you're not regulated yourself and if you're not looking after yourself, then it is impossible for you to be looking after children that aren't regulated. And so speaking to all of you, you need to be looking after your own mental health. It's like the oxygen mask on the aeroplane. You've got to put your own oxygen mask on first before you help somebody else with their oxygen mask. You've got to look after yourself, otherwise you're not going to be able to give your patients what they need. So one thing that you can do is you can create a self-care plan for yourself. So think about things that you do, and we'll talk about different ideas in a minute, throughout the week, and maybe identify a list of 5 things that you do every week that are good for your mental health. Like I say, we'll talk through some ideas in a minute. Sometimes it is just these little bits every day that build up. If you could show the picture that I've got, Laura. So I don't know if you remember, a couple of years ago, there was this great big ship that got stuck in the Suez Canal. And it was absolutely massive, blocking the whole canal. And for those of you that can't see the slides, on the picture, that ship is labelled "My Anxiety from All the Death and COVID." And next to this ship, there was this little tiny digger that was kind of digging out the side. And, you know, the picture doesn't do it justice. This ship was absolutely massive when you saw it from a distance, and the digger just looked so tiny in comparison. And on the picture, it's labelled mindfulness. Because the point it's trying to make is people suggesting something like mindfulness to you when you've got all that stress going on just seems silly, doesn't it? Like the resilience training that we were offered. But actually, the story of this ship, I think, is the story for us. That ship was stuck there for about 3 weeks, and there was little diggers. There was a couple of little diggers on the one side and a couple of little diggers on the other side. And there was some little tiny tugboats. I don't know, you probably saw the pictures. The pictures looked really funny because these little tugboats just looked absolutely tiny in comparison to the size of the ship. But all those little things working together over about 3 weeks finally managed to move that ship. And when we're thinking about self-care, it is all these little things that we put around us over time, doing them regularly will help. So some of the ideas that I've got, things like removing your badge when you leave work and having that leaving work routine so that you can leave work at work and enjoy your time at home. Whatever the routine is that you have for that. For me, it was removing my badge. I'd get in my car, take my badge off. I'm no longer Dr. Hawkins, I'm just Cheryl now. Having someone to talk to, and all those wonderful things that Natalie was talking about the professional support that would be in your job, whether that's reflective practice, clinical supervision, or the team that you're in. Thinking about, you know, extending your community further, you know, who have you got outside of work as well that you can talk to? And have fun. You're a play specialist, you know how to have fun. So play, as we've said, is really important for kids in hospital, but it's really important for you guys as well. What can you do in your life that is playful? Could you meditate as well? Yoga, relaxation, massage, all those sorts of things are wonderful. Exercise, music, reading, getting a good night's sleep, eating well, creative hobbies like sewing or painting, getting outside and enjoying the fresh air, whether that's gardening, walking. There's so many things that we can do. And this on the screen is Action for Happiness. I love Action for Happiness stuff. If you've not seen it, go and check out their website. They have calendars with little things that you can do every day to build up to these things that they've listed, their 10 keys to happiness, which again, you can see on the screen, but for those of you that can't, that's giving, so doing things for other people, relating, connecting with other people, exercising and taking care of your body. They include nutrition in that. Awareness, so that's the mindfulness stuff about noticing everything through your senses, trying things out and learning new things, having goals to look forward to, that's direction, resilience, finding ways to bounce back from the difficult times, emotions, looking for what's good. So that's about, like, you know, having your gratitude journal or your little jars, like again Natalie was talking about, finding the good things in life. Acceptance, being comfortable with who you are, and meaning is being part of something bigger, whether that's religion or a kind of organisation that you're passionate about. So yeah, loads of different things that you can do for your well-being. So do remember to put on your own oxygen mask first. Thank you for inviting me.
Cheryl, thank you so much for that. There was so much good stuff in there, and I love that image of the sort of like impossible ship to move, that impossible big blockage that eventually, just with very little bits of self-care, starts to move eventually before you know it. So thank you so much to our presenters. It is now over to you for discussion, questions. Please raise your hand if you have a specific question for any of our presenters. I'm going to address a few things that were in the chat already. Lisa, you mentioned that those activities sounded really great, and perhaps that's something that Starlight could do. And I feel very positive about that. I wanted to also draw your attention to what we've started trying already. So our Playwell box that was put out this week, originally it was resources for older children. So anyone really sort of like 8 or 9 plus who might want something a little bit more advanced, and there were some pamper activities in there as well. Using the feedback from that activity, we developed a version of that for the families that we support when they're at home, and that went out in October this year in parallel with Play in Hospital Week. And because of Play in Hospital Week, settings were able to receive a version of the Playwell box, the Wellbeing Play box, which was for a spread of ages, just thinking about that journaling and that sort of sensory play, that mindfulness. I have to say that Starlight are on a journey of development, and we're very, very open to hearing what the needs are from practitioners. And so I wouldn't be surprised if that is something that we start to develop as a line really soon. There was also a question for you, Natalie, around how do you manage to protect the time to have that hour-and-a-half meeting when you've got busy workloads and such a big team?
That's a good question, thank you. So for us, it's about forward planning and timing it to a time that works for us. So we try to go for the afternoon so that we can do as much as we can before our meeting comes, so that the meeting can be a priority. And I think it's just remembering that, yes, the patients are always going to be our priority, and they're always going to be the main reason we're there and the main thing that we are focusing on that day, but also giving that time for ourselves to support each other and talk about what we need to talk about and idea share. It's also got to come as a priority. So we will generally find Friday afternoon is when it works best for our team. It's taken a lot of trial and error to find that time that works. And we try to give it certain time scales. So, you know, we'll have 15-20 minutes to information share about the patients, then we'll have another 20 minutes for some skill sharing for somebody else to take the meeting, and then we have the sort of 20 minutes at the end for the team building game, and it's breaking it down into that time and just being very aware of how the time is going. But yes, it's definitely taken a lot of trial and error to get there to make it work for us.
I can imagine. And Natalie, another question for you. And if anybody else has any questions, please do raise your hand. I want to know, could you quickly describe that game to us? Taco cat goat cheese pizza, just briefly.
Yes, Rebecca will probably be best to explain this one. She's the one that taught us.
It's similar to Snap, but you have cards. One has pictures of tacos, one cats, guts, cheese and pizzas. And you go around the circle, and as you put a card down, you say the word taco, the next person will say cat, cheese, pizza. And if what they say matches the picture on the card, you have to snap. The last person to put their hand there takes the card. However, there's also a groundhog in there, a narwhal and a gorilla. And for those three, you have to do specific actions before you snap the cards. And people quite often just get really confused and mixed up about actions, and it's just really fun.
So nice and simple.
Yeah.
I can imagine the chaos that ensues. Lots of people in the chat also saying that they play this game and they love it. Thank you as well to the people who are commenting around the usefulness of the resources that they receive and the surprising uses that they find. So to use the fidget toys within toileting, wouldn't have planned that, but that's absolutely brilliant. And a positive capsule box. That sounds lovely for young people, getting all the staff who've worked with a child or young person to write a nice thing about them for them to look at whenever they're struggling. That is absolutely lovely. That reminds me of Georgia the Joy Jar, Natalie, which I'm hoping that we can adopt within our Starlight team as well. That sounds like a really good thing to have. If there are no other questions, I think I might use this as an opportunity to give everybody 5 minutes back of their planned time out of their preciously balanced day. And just to say thank you so very much to Natalie, Rebecca and Cheryl. Thank you to NAHPS and HEPSET for working with us year on year to make Play in Hospital Week so impactful and effective and positive and uplifting. And thank you to you as practitioners for everything you do. Please remember to put on your own life best first. Take care, enjoy the rest of your day.
Thank you, Laura. Thank you for sharing. Thank you.